Hi, Beatrice. Welcome to the webinar. Hi again. My name is Janet Dunn. Again, I'm the Admissions Outreach Coordinator here at Keck Graduate Institute. And here with us today for our faculty speaker, we have Dr. Stephanie Kourtakis, who's the Assistant Professor of Clinical Services. And Dr. Kourtakis will be speaking on the pharmacist's role in self-care. So please feel free to unmute yourself or type out any questions you may have in the chat regarding our webinar. But Dr. Kourtakis, I'll give it over to you.
All right, thank you so much, Ms. Stone, for the introduction. Welcome. I'm so excited to be providing this webinar today. So again, my name is Dr. Stephanie Kourtakis. I am an Assistant Professor of Clinical Sciences, and I teach at the Doctor of Pharmacy program here at Keck Graduate Institute School of Pharmacy and Health Sciences. And today, the webinar will be on the pharmacist's role in self-care. So I do have 5 objectives for today's presentation. So by the end of the presentation, the audience should be able to define self-care as it pertains to pharmacy practice, discuss the role of pharmacists in self-care, describe the steps of the pharmacist patient care process, or PPCP, and its role in self-care, compare and contrast non-pharmacologic and pharmacologic treatments, including prescription and non-prescription medications, and apply the pharmacist patient care process to a patient case. Before we get started, a couple of definitions. So first off is non-pharmacologic treatment. So this just means non-drug treatment. This could be diet and exercise modifications. This could be using things like heat or even avoiding pollen, just things that do not require an active drug ingredient. Versus pharmacologic treatment just means a type of treatment that contains a drug. And out of our pharmacologic treatments, we have 2 types. We have prescription drugs, which require medical supervision and a prescription from a licensed provider for use, and then non-prescription drugs, which do not require prescription or medical supervision and can be obtained over the counter at a pharmacy. So what is self-care? So take a moment before we provide a definition, and how would you define self-care? For me personally, I like to think of self-care as a spa day, but there are many different definitions and many perspectives on what self-care is, both from patients and consumers, as well as healthcare providers. So one definition is management of conditions with treatments available to patients without a prescription. So these are ways that patients can self-treat without going to a doctor for a prescription medication. So oftentimes, especially in the pharmacy realm, we think of over-the-counter products. So medications that you can buy in the pharmacy aisles. This could be drugs or even non-drugs, thinking of heating pads and nasal sprays that do not contain medication, things like that. Self-care can also include lifestyle modifications, so changes to diet, avoiding certain foods or adding certain foods to the diet, different types of exercises, even things like sleep habits, avoiding watching TV too late at night or exercising too late at night, and even things like yoga or massage. Self-care can also include things like health screenings and wellness checkups. So how is self-care currently used in the market right now? Well, both healthcare providers and patients tend to prefer to treat minor ailments with self-care before they seek professional care, before they go and contact their doctor and go and make an appointment. And actually, it's been shown in recent reports that the availability of non-prescription treatment can save around $147 billion per year. And in fact, of all the products, the number of tablets and types of things that are sold, 60% of the pharmaceutical volume is actually non-prescription therapies. And of our non-prescription therapies, over 100,000 products are currently available, and this is continuing to grow. In the recent years, a lot of products that used to be prescription only have converted to non-prescription and are available for the consumer to purchase without going to the doctor. So how do patients decide which types of things to use to treat these ailments? Well, in addition to seeking care from their healthcare professionals, they may conduct searches on the internet. They may ask their colleagues and community or friends and family what they've tried and has been helpful. So with the internet available and Google and WebMD around, how do the pharmacists have a role in self-care? Well, there's lots of things that the pharmacist can do besides guiding a patient to the appropriate aisle. First thing they can do is determine whether the patient's condition is actually appropriate for self-care. There are certain times when perhaps what the patient is suffering from may not be treatable with the products that are available non-prescription, and they may require something stronger that needs a prescription or medical supervision. And other times, what a patient may be suffering from may be a result of an underlying condition, whether diagnosed or not diagnosed yet. And in that case, they should be seeing their healthcare provider in order to be treated. In addition to deciding whether or determining whether the patient is appropriate for self-care, the pharmacist can also help recommend the best non-prescription product available. So this could be something that has an active medication or even a non-pharmacologic measure, such as making modifications to the diet or lifestyle. Thirdly, pharmacists can help ensure safe and effective use of self-care treatments, making sure that they are safe in regards to avoiding drug interactions with other medications the patient may be taking or other conditions that they might have, and make sure that the product or treatment is effective, making sure that whatever the patient is going to be using actually helps to alleviate what they are suffering from. And in a recent report or survey that was conducted in 2015, pharmacists on average stated they would perform self-care consultations approximately 7 times per day. So this is something that is commonly done by a pharmacist, and this is continuing to grow. So some of the types of counseling that pharmacists will provide, so they will help patients select the appropriate product, discuss potential drug interactions with things like other medications, foods, or even medical conditions, and also counsel the patient on appropriate dosing, making sure they're getting enough of the medication but not too much, and also appropriate administration. Some medications may not be taken simply orally and may require some device counseling or other types of administration that's not just taking a pill or a liquid. So let's take a look at what this might look like in real life. So let's imagine a patient case, and this patient case that we will work through together today is not a real patient. This is a simulation. So we can imagine you are working as a pharmacist at a community pharmacy, so a retail pharmacy such as CVS or Walgreens. A patient who appears to be in their 50s approaches the pharmacy counter and asks, which is better, Dayquil or Advil cold and sinus? So how would a pharmacist approach this situation and be able to provide care and assistance to this patient? Well, we use something that's called the pharmacist patient care process. And this is a process that's used by pharmacists to provide consistent services to patients. Now, while we're talking about the self-care setting that's normally in the setting of a community pharmacy, this can be applicable to any practice setting. So not only in the community pharmacy, but also in the doctor's office, in the emergency department or urgent care, and the PPCP is actually used in all sorts of pharmacy settings in addition to those ones. And with the pharmacist patient care process, pharmacists strive to create patient-centered care plans so that the patient is involved in the decision-making process and also collaborating with other healthcare professionals such as doctors, nurses, dietitians, other types of providers to help ensure the best care plan for each patient. So we'll briefly go over the steps of the PPCP and then focus in on how the PPCP is utilized in self-care. So the 5 steps of PPCP are collect, assess, plan, implement, and follow-up, which includes monitor and evaluate. Here's a picture of what you may see in the pharmacy school and across the pharmacy profession, an image of the pharmacist patient care process. And we won't go into too much detail in this slide on each of the components, but basically the pharmacist will start by collecting information. They can collect information from the patient records, and from other healthcare providers who may document information about the patient. The pharmacist will then assess the information that they have collected and analyze and determine an appropriate therapy that may help achieve optimal care for the patient. They will then collaborate with the patient and other providers, if applicable, to develop an individualized patient-centered care plan. After developing the plan, the pharmacist will help to implement the plan, whether that is by educating the patient on the care plan or administering immunizations or even administering medications. And after the plan has been implemented, follow-up monitoring and evaluation is also important. So making sure that implementation of the plan has taken place and to make sure that the plan has been effective and safe. So we'll walk through this process together and also focus on the self-care setting. So for this portion, it will be more focused on self-care. There is more broad aspects to the PPCP that is not discussed in this particular presentation, but you could see if you practice as a pharmacist. So the first thing we'll want to collect is what's called the chief complaint, or the main reason the patient is presenting for care, and also the history of present illness, or HPI. And this is really just the story of how the symptoms or illness or ailment developed. The pharmacist will also want to collect relevant health information, the health history, so what other medical conditions the patient may have, if there's any pertinent surgical history or pregnancy type of history. The pharmacist will also collect the medication list, so what are all the medications that the patient is taking, and this can include both prescription medications and non-prescription medications, including even vitamins, dietary supplements, and even herbal products. Other information that the pharmacist may collect are what are called patient-specific factors. So different lifestyles, so for example, maybe their occupation may require them to be busy throughout the day, and this may affect what therapies may be better for the patient. Preferences and beliefs, so some patients, for example, may prefer non-drug types of therapies, and desired outcomes. Are we trying to help symptoms a little bit? Are we going to cure disease? Do we want total resolution of symptoms? What are the outcomes that we are looking for? And in the self-care setting, we use a certain type of interview strategy using what's called the SCHOLAR-MAC acronym to ensure that the pharmacist does collect all the relevant information in order to make an appropriate recommendation. So in the next slide, we'll talk about what SCHOLAR-MAC stands for. So the first thing we'll want to ask about is the symptoms. So what symptoms is the patient experiencing? We then want to ask a little bit more about the symptoms. What are the characteristics? What is the situation like? How severe are the symptoms? And have they changed? Next, we want to ask about the history. Has anything been done so far to help the symptoms? And have they happened before? We'll also want to know the symptom onset. So when did it start? We also would like to gather the location of the symptom, if it's a certain part of the body or the whole body. And we also want to ask about aggravating and remitting factors. So what makes the symptoms better and what makes them worse? And then we have MAC, which stands for medications, allergies, and conditions. So we want to ask about all the medications that the patient is currently taking. And again, not only just prescription medications, but also non-prescription or over-the-counter medications, vitamins, supplements, and other natural products. We also want to ask about any allergies, and this could be allergies to medications, allergies to food, or allergies to other substances. And lastly, we want to collect any medical conditions that the patient may have. And all of this information will be used to help the pharmacist to assess the patient and provide an appropriate care plan for that patient. So let's go back to our patient case. So if usually in the self-care setting or in the community pharmacy setting, we'll obtain this information through an interview with the patient. So if we were to ask the patient those questions that we just went over, these are the answers that the patient has provided. So our patient today is Ms. Doe, who is a 56-year-old female. Her symptoms are stuffy nose, sore throat, dry cough, and they're causing her some trouble sleeping. She says that she has no fever, chest pain, or shortness of breath. She also took a COVID-19 test this morning, and this result was negative. She also describes her symptoms as bothersome, but not enough to prevent her from completing her work. And she says that she's had these symptoms in the past, but has not tried anything to help yet, other than some Tylenol PM for sleep. The sore throat started a couple days ago, and then her nose became runny, and her stuffy nose and cough started last night. As far as location, her symptoms are in her nose, sinuses, and throat. She states that her symptoms tend to be worse at bedtime, and she's not sure if there's anything that makes them better. For medication, she uses what are called selegiline patches for depression and the Tylenol PM to help with sleep. She has an allergy to codeine and says that this causes nausea, and her medical conditions include depression and chronic kidney disease. There are some other information that we can collect from the patient. So what is called social history. So these questions are about smoking, alcohol, and illicit drugs, and these can actually have an impact on our care plan as well. So in this patient's case, she is a non-smoker. She says she has 1 glass of wine 2 to 3 times a week and does not use illicit drugs. She works as a 4th grade teacher, and this information can sometimes be helpful to determine perhaps dosing and administration of therapies if they would be appropriate with the patient's occupation or time that they may be available to take their medicines. As far as immunizations, she received her flu vaccine last year. She's up to date on her COVID vaccines, and she's not sure about her other vaccines. She also prefers once daily dosing of medicines and doesn't like swallowing pills. So there's a lot of information that we can gather from the patient through the interview and use this to assess an appropriate plan for the patient. So our second step is to assess. So what are some of the things that we will assess as a pharmacist? First is treatment. We'll want to ask ourselves, is current treatment ineffective and is additional treatment needed? Other things, after gathering information about the patient's symptoms and history of present illness, what is the likely cause of the patient's symptoms or condition? And potentially, are these symptoms caused by side effects from another medication? Other things that the pharmacist will assess are the patient's history and risk. So are there certain risk factors that can make some of their symptoms potentially worse or cause complications? And also, how do other factors such as the patient's health literacy or their ability to obtain and appropriately use a treatment plan, cultural factors, health beliefs, and preferences, how can those affect the patient-centered care plan? And in the self-care setting, one of the most important questions that we'll ask is self-treatment appropriate in this case? So with our patient, is the condition or symptoms that they are experiencing, are they outside of the scope of self-care? Is it something that would not be able to be treated with what's available over the counter? Would something like a prescription medication or something that is evaluated and treated by or supervised by a physician or other prescriber necessary? Is the patient ineligible for non-prescription therapy? This could be due to having certain medical conditions, certain allergies that would make it so that the treatments that are available over the counter would not be appropriate for that patient. And do they need further evaluation by a healthcare provider? Do they perhaps have underlying health conditions that may complicate their treatment or the treatments that are available? So thinking about those items, let's go back to our patient case with Ms. Doe. So thinking about all of the information that we've collected from her, the pharmacist may evaluate that her symptoms are likely caused by a common cold. We think about the negative COVID-19 test, so we think it might not be COVID in this case. Based on the symptoms that she has and the symptoms that she doesn't have, it's more likely common cold than flu. So these are some of the things that a pharmacist can learn and evaluate in this case. As far as her treatment, she's just tried Tylenol PM, and it seems like she does need more treatment to help with her symptoms. And while we won't dive into all of the parameters or exclusions for self-treatment or reasons that self-care may not be appropriate, we'll determine at this time that self-care is appropriate. Some of the things that can make self-care inappropriate are if the symptoms have been occurring for a longer amount of time, or if the patient has underlying conditions that can make self-care inappropriate at this time. Some other things we'll assess. So thinking back to the patient's original question, is Dayquil or Advil cold and sinus better? Well, as far as efficacy or effectiveness at treating the symptoms the patient is experiencing, as a pharmacist, we'll know that the ingredients in both Dayquil and Advil cold and sinus do help or are known to help treat the symptoms that the patient is experiencing. So in that case, both of those could be options. However, as a pharmacist, when we learn about the safety of different medications, we actually find some problems with this particular case. So there's 3 problems that have been identified with these medications. The first is that one of the ingredients in both Advil cold and sinus and in Dayquil can interact with the patient's selegiline patch. Also, an ingredient in Advil cold and sinus is actually inappropriate for patients who have chronic kidney disease. And so also, an ingredient in Dayquil duplicates an ingredient found in Tylenol PM. So we have a few problems here. So we have a drug-drug interaction with the selegiline patch. We have what's called a drug-disease interaction with the Advil cold and sinus and chronic kidney disease. And we have a duplicate therapy with an ingredient in Dayquil and an ingredient in Tylenol PM. So we have a few safety issues here. So another option, instead of perhaps the Advil cold and sinus and Dayquil, Ms. Doe may benefit from other drug or non-drug treatments. So step 3 of our PPCP is the plan. So now that we've collected information and assessed that information, we'll work together with the patient to develop a patient-centered care plan. So in self-care, we tend to have about 3 general recommendations. Either we can recommend a self-care plan where the patient can self-treat, and this can include pharmacologic treatment, non-pharmacologic treatment, or both. Other times, our recommendation can be to refer the patient to a healthcare provider. In those cases, they are not a candidate for self-care, and there isn't a good option for them to treat at home. They'll need to be evaluated by another provider and perhaps need some more testing or a prescription therapy to treat their symptoms. And other times we have a combination of both. We can advise the patient that what is available over the counter won't be enough to treat them, and they'll need to see their primary doctor or go to the ER or the emergency room. But in the meantime, until they can see a provider, there may be some strategies they can use to help until then. Some other components of the plan. So we'll want to, as pharmacists, provide the self-care recommendation, and this will include both non-pharmacologic and or pharmacologic treatment. We'll want to define the goals of therapy. So is the goals of therapy to help alleviate symptoms? Is it to cure a disease, or is it to prevent complications, or a combination of those goals? And what are the anticipated outcomes? So similar to the goals, should the patient expect to have some relief from the symptoms within 5 minutes, 30 minutes, an hour, a day? And what are some other outcomes that may occur, any side effects that may occur with the medication or treatment? And the expected timeframes is definitely very important, because if our treatment plan, if the patient implements the treatment plan and they're not experiencing those anticipated outcomes, another option or medical treatment or evaluation may be needed. And lastly, the care continuity is also part of the plan. So definitely defining when to expect those results and reviewing with the patient and deciding what to do if the treatment goal is not met. The duration of self-treatment before seeking healthcare provider evaluation, also reviewing any adverse drug reactions and what to do if the condition worsens. So going back to Ms. Doe, these are some of the things that you would learn in pharmacy school and as a pharmacist. So we have some recommendations for her for non-pharmacologic or non-drug treatment, for drug treatment, as well as we can go over expectations and when to seek care. So for non-drug treatment, we can offer some of these modalities. So the patient can increase fluid intake and get some extra rest. She can use a humidifier or raise the head of the bed. Saline nasal spray is a non-drug type of spray that she can use for stuffy nose. For sore throat, she could try salt gargles. And to prevent transmission of the cold or the virus that may be causing the cold, frequent hand washing measures can be implemented. We have some options for pharmacologic treatment as well that will not interact with her medications or with her conditions. Vicks Vapor Rub might help, and so can sore throat drops or sprays. So what the pharmacist could do is offer some of these options to the patient and ask the patient what they might prefer out of those options. Then once the patient has decided on a plan, the pharmacist can help educate the patient on the appropriate use of that treatment plan. So the pharmacist should also go over the expectations. So in this case, the patient should expect some relief of symptoms, and resolution of symptoms should occur within the next 7 to 10 days. And it's important that the pharmacist also goes over when to seek care. So in this case, if the patient's symptoms do not resolve in 7 to 10 days, or if they worsen, she needs to contact her doctor. The next step in PPCP is implement. So in implementation of our plan, the patient can start, stop, change, or administer treatment. The pharmacist can also go over preventative care strategies. So in this case, perhaps discussing getting the patient's annual influenza vaccine in the future. In the self-care setting, education and self-management training is one of the main components of the implementation process. The pharmacist can also discuss coordination of care, so going over when to seek medical attention or when to follow up regarding the symptoms, and could even help schedule follow-up care if needed. So in this case, there's lots of education that the pharmacist can provide. If the patient chooses to utilize a saline nasal spray, the pharmacist can review appropriate administration of the nasal spray so that the patient can get the most benefit and safe use of the nasal spray. Some other counseling points that pharmacists would know or you would learn in pharmacy school are some counseling points about the Tylenol PM, to only use it as needed and for a short duration. And while using Tylenol PM, avoid other products that contain the active ingredient acetaminophen, and also avoiding alcohol. If the patient does choose to use sore throat drops or sprays, these can be administered every 2 hours. And if they use any drops or lozenges, do not bite them or chew them. And lastly, it's important to go over when to seek medical attention. So if the patient experiences an allergic reaction to any of their treatments, or if the symptoms worsen or do not improve in 7 to 10 days, they need to seek medical attention. Step 5 of the PPCP is follow-up. So this involves monitoring and evaluation. So once the patient goes home with their treatment, they can evaluate the effectiveness of the treatment. So are their symptoms resolving? Is the treatment helping? Also safety, so is the patient experiencing any side effects from the treatment? Some other things that we may look at, adherence to therapy, so is the patient following the treatment as discussed? So for example, if they're using the sore throat drops or sore throat spray and they're only using it once a day, they may not be following the up to every 2 to 4 hours and may not be getting the expected results. So also look at clinical outcomes. So in self-care, this may just be looking at their symptoms, seeing if they're resolving, and making sure that nothing else is developing and nothing else is getting worse. So that summarizes the pharmacist patient care process. Again, this is something that's utilized among different settings in pharmacy, so not only in the community retail setting, but can also be used in the emergency department, in the primary care or doctor's office. It's even used in the hospital setting as well. But we focus just more on the self-care setting, which is more targeted towards specific symptoms. Other things pharmacists can evaluate in self-care are certain populations that may be at higher risk for medication-related problems, specifically in children or pediatric patients, older adults, or geriatric patients, in pregnant patients, and in breastfeeding patients. So what can happen is that with pediatrics or children, their bodies may process medications a little bit differently, and this can affect how drugs or medications or treatments can be processed and handled by the patient. In some cases, they will have a different dose than an adult patient, or even not be able to use certain products because of the way the body can process it. Also in our children, we don't have as much data. We don't have as many studies on all of these treatments. So we have to take that into consideration. When evaluating our pediatrics or children, we'll want to collect not only the information we discussed earlier in the presentation, but also their age and weight, because this can often affect the way that medications are dosed. And we'll want to make sure that the children are getting enough medicine, but of course not too much to cause side effects or toxicity. Also with their pediatric patients, it's important to educate the caregivers or parents on appropriate dosing and administration. Oftentimes, our children are given specific doses for their age or weight, and we'll want to make sure that the caregiver is able to administer that appropriately and give them the correct dose. One of the main counseling points is that caregivers should avoid using household spoons to measure the medicine. So if they are instructed to give 1 teaspoon or 1 tablespoon, they should use the cup or syringe that's provided with the medicine and not use a household spoon, because these could be inaccurate and lead to inaccurate dosing. Some other counseling points for our children. Again, we'll want to use the dropper or syringe or cup if they're getting an oral medication. We also advise parents or caregivers to avoid placing these medications in formula, because what can happen is the child might not finish the whole formula and they might not get all of their dose. And remember that this will be small amounts of medication, and so if they're mixing it with food, you'll want to do just a little bit so we make sure that the child gets all of the medicine. For toddlers, we instruct caregivers not to refer to medication as candy, because we want to make sure that they're not accidentally consuming too much of it. And for those medicines that may not have a good taste and they don't want to take the medicine, they can try mixing it with a small amount of food or drink. The next population that we take special consideration to is our older populations, our geriatric patients. In general, this means patients who are 65 or older. And so what happens with our bodies as we get older is that our organs don't function, maybe as efficiently as they do as younger adults. And so this can slow the process of the way that the medications are broken down and absorbed and eliminated from the body. And what can happen with this is if they are not broken down as quickly as an adult patient, they can stay in the body longer and cause more side effects. We also consider what's called polypharmacy. And this is really just talking about when a patient is taking 5 or more medications at the same time, because then we have higher risk of drug interactions, of side effects, and we don't want to mix, medications that could cause toxicity or complications. Oftentimes in our geriatric patients, they also have multiple medical conditions. And with our medicines, some medicines may not work well with certain medical conditions, so we want to be cautious of that. There is what's called the Beers list that you will learn in pharmacy school or could look up online, and this lists a number of what are called high-risk medications for patients who are 65 or older or geriatric. And in some cases, it's okay for patients to be on these high-risk medications as long as they're being closely monitored by their healthcare provider. And next, we have pregnant patients. So we want to be very cautious with the medications that are used by patients who are pregnant, because many medications do cross the placenta and can cause risk to the developing fetus. So it's important as pharmacists to ask all females of childbearing age if they are pregnant. And this could be a kind of sensitive question. A lot of my students will ask, how do we appropriately ask that? And one strategy is to say, is to really just give context for why we are asking the question. So we can say something like, many treatments or medications can have the ability to cross the placenta and cause risk to a developing baby. So we just want to make sure that we ask every female of childbearing age if they might possibly be pregnant, just to make sure that we don't cause, that extra risk. Next, if we do offer different treatments to the patient, we'll want to assess safety of that use during pregnancy, see if they're getting any side effects, make sure that they are following up with their doctor as well. And oftentimes with pregnant patients, we'll want to use non-drug therapies, but we often encourage patients to avoid, trying other natural remedies without discussion of those potential treatments with their doctor or pharmacist. Because what can happen with those, even though they are natural, that doesn't mean that they can't cross the placenta, they can't cause potential risk to the baby or interact with medications or with medical conditions. And the last population we'll talk about today is the breastfeeding patients. So with our patients who may be breastfeeding, medications that they take may go through the breast milk and be exposed to the infant. And we talked about with our pediatric patients, our children, they may process medicines differently, and some medicines may not be appropriate for them. So we want to make sure, first off, that the infant isn't exposed to any medicine that would be harmful to them. They may also experience more side effects from the medicine than the adult mom would. And in some cases, some medicines may not be harmful to the baby, but they can affect milk supply. So some medications can actually decrease milk production, and that can be a problem to a mom who may be breastfeeding. So similarly with pregnancy, it's important to ask each patient if they might possibly be breastfeeding to make sure that we can make an appropriate recommendation. If the patient is breastfeeding and using a medication, we'll want to make recommendations of medications that have the shortest duration of action. Some medications we think of that we have to dose every 2 to 4 hours or every 6 hours versus something that may be a 24-hour medication, something that is shorter and won't be present in the body or in the breast milk too long will be a better option. So that summarizes some of the ways that self-care is utilized by pharmacists and some of the roles that pharmacists have in helping patients treat without going to the doctor and using therapies that may be available over the counter. So for self-care that's taught in the Doctor of Pharmacy program, I actually coordinate 2 courses. These fall in the first year of pharmacy school in the fall. We have Integrated Series 1, which is Introduction to Pharmacy Practice. This is a 5-credit-hour course that involves patient communication, so how to appropriately interview patients, establish a good pharmacist-patient relationship, and also to communicate well with other healthcare providers. We dive really deep into self-care pharmacotherapy. So today we got a little taste of what it might look like to gather information from a patient and decide what therapies may be appropriate or inappropriate for the patient. So we go into all sorts of different conditions and symptoms the patient may be experiencing and different treatment plans for that patient. Also in this course, we discuss point-of-care testing. So this is an evolving role of the pharmacist where they can conduct blood pressure testing, blood sugar testing, what is called the hemoglobin A1C, which is used to either screen for diabetes or evaluate patients who have diabetes. Also learn cholesterol testing and other types of tests that are available over the counter for patients to use. So that is the lecture-based part of the course. And then we have a corresponding recitation, which is a 1-credit-hour course, which is a 3-hour per week lab that involves application of all of the competencies discussed in the lecture-based course. So as part of that course, I also coordinate. We do a lot of simulation and role play activities. We practice pretending to interview patients, counseling patients, discussing our recommendations with a doctor. So we get to practice all that. So by the time our students are in the pharmacy for their experiential work in a community pharmacy or on their advanced clinical experiences, they have some practice from the classroom. And we also practice hands-on point-of-care testing so that our students are also equipped to be able to conduct these tests in practice. And this can be at health fairs, this can be on their experiential rotations or as a pharmacist in the future. So we'll learn how to test blood pressure, sugar, cholesterol, all of those things. And so while these courses are currently housed in the first semester of pharmacy school here at KGI, these competencies are integrated throughout the entire curriculum. So even when we've completed the courses, these skills and clinical competencies come back as students continue on through the curriculum. So they may be learning diabetes in the future or infectious disease, but they're sprinkled in more practice and review and reinforcement of these skills. This is both in the classroom and also in the experiential curriculum. So when our students are on clinical rotations in the pharmacy or in their advanced practice rotations in their fourth year pharmacy in various settings, they'll also get to reinforce and practice these competencies. And with that, that concludes my presentation today. Thank you so much for your attention and for your time and watching this presentation. At this time, I am happy to take any questions, and I've also left my contact information here. Please feel free to contact me at any time with questions about self-care or about KGI or the Doctor of Pharmacy curriculum. Thank you so much.
Thank you so much, Dr. Kourtakis. Beatrice, do you have a question? You can feel free to unmute yourself or type it in the chat. All right, Beatrice typed out the question in the chat. It says, what are the roles a pharmacologist can play, especially with scenarios relating to pharmacologic treatment?
Yeah, so thank you so much for your question. So as far as the Doctor of Pharmacy program that I'm most familiar with, this is where we train students to become pharmacists who can practice in the community pharmacy and in the hospital and in other roles. As far as pharmacologic treatment, so in the outpatient or non-hospital setting, pharmacists can make recommendations to patients on products that are available over the counter or are non-prescription. And in other settings, some pharmacists may work in the primary care settings at a doctor's office. So that's actually where I currently practice, is in a doctor's office. And pharmacists can also evaluate the patient, interview the patient along with the doctor, and make recommendations to the doctor for different treatments. And these can be both drug treatment and non-drug treatment. And in certain cases too, in certain roles, pharmacists also have the ability to prescribe under what's called a collaborative practice agreement. So pharmacists can write prescriptions for patients for certain medications and monitor them, so following up with them and seeing how those treatment plans are working for them. They can also order and evaluate labs. So for example, my role is working at a doctor's office specializing in diabetes management. So I'll actually meet with patients who have diabetes and interview them, we'll develop a treatment plan together, and I'll actually write the prescriptions for them and order labs for them, and then follow up with them and then modify that plan as needed. As far as pharmacists versus pharmacologists, I'm most familiar with the pharmacist role, which is the drug expert who can help dispense medications and ensure that the medications that are prescribed are going to be safe and effective, counseling patients on proper use of those medications, and also chronic disease management, like discussed with the working in the doctor's office. And pharmacists can also work in the hospital setting as well. So they work on the floors where patients may be more sick and in hospital beds, and work with the doctors to evaluate the patients and make treatment recommendations.
Thank you so much for answering those 2 questions. Beatrice, do you have any other questions? All right, well, thank you so much, Dr. Kourtakis. I see your information is still on at the screen, so if anybody has any questions, please feel free to reach out to our admissions team at admissions@kgi.edu. We really appreciate your time in watching this video as well as attending, and we hope you have a wonderful rest of your day. And thank you so much. Bye.
Thank you.